Friends, have you ever struggled with acidity, indigestion, or acid reflux? That burning chest pain, sour taste in the throat, or bloating after meals? You are not alone. Millions of people face these problems every single day. In today's video, we will talk about the three main groups of medicines doctors prescribe for acidity and reflux, how they work, how long they are usually taken, their possible side effects, and the typical starting doses. Everything explained in very simple language. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. So let us begin. Acidity, indigestion, and reflux happen when the stomach makes too much acid, or when acid escapes upwards into the food pipe. This can cause heartburn, chest discomfort, sour taste in the throat, nausea, or bloating. When it becomes frequent, doctors call it GERD, gastroesophageal reflux disease. Doctors usually use three groups of medicines to treat these conditions. Before I explain, do not forget to subscribe and share this channel so that more people can learn health in simple language. The first group is antacids. Examples include Tums, Rolaids, Mylanta, and Gelisil. They work by quickly neutralizing the acid already in your stomach. That is why they give fast relief, but the effect is temporary. They are best for mild or occasional symptoms. The second group is H2 blockers. Examples are Famotidine, Cimetidine, and Nizatidine. They work by blocking the signals that tell the stomach to make acid. This reduces acid production, and their effect lasts longer than antacids, up to 12 hours. Doctors usually prescribe these if symptoms are more frequent. The third group is proton pump inhibitors, also called PPIs. Examples include Omeprazole, Esomeprazole, Pantoprazole, and Lansoprazole. These are stronger acid blockers. They allow injured tissue in the food pipe to heal and give long-lasting relief. They are usually prescribed when symptoms are persistent or severe. Doctors often advise a 4 to 8 week course. Now, how long should these medicines be taken? Most people need them for a short course, about 4 to 8 weeks. Some people with mild symptoms need them only occasionally. Others with severe reflux, ulcers, or damage to the food pipe may need long-term treatment at the lowest effective dose. Always follow your doctor's advice about duration. Let us talk about side effects. Antacids may cause constipation or diarrhea if used too much. In rare cases, calcium-based antacids may cause kidney problems if overused. H2 blockers are generally safe but can sometimes cause headache, dizziness, or fatigue. In elderly patients, confusion can rarely occur. Proton pump inhibitors are safe for most people, but long-term use may be linked to increased risk of infections, vitamin or mineral deficiencies like magnesium and vitamin B12, or very rarely, bone fractures and kidney problems. Most people tolerate them well, but it is important to review with your doctor. Now, the typical starting doses. Antacids are usually taken as 1 to 2 chewable tablets, or 10 to 20 milliliters of liquid, usually after meals and at bedtime. Do not exceed the maximum written on the package. For H2 blockers, the usual starting doses are Famotidine, 20 milligrams once or twice daily, Cimetidine, 200 milligrams up to twice daily, Nizatidine, 150 milligrams twice daily. For proton pump inhibitors, Omeprazole, 20 milligrams once daily, taken 30 to 60 minutes before breakfast. Pantoprazole, 40 milligrams once daily before breakfast. Esomeprazole, 20 to 40 milligrams once daily before breakfast. Lansoprazole, 15 to 30 milligrams once daily. Most courses start at these doses, usually for 4 to 8 weeks. Your doctor may adjust based on your symptoms, response, and overall health condition. Now, some important advice for patients. Always tell your doctor about other medicines you are taking. Some can interact with acidity medicines. If symptoms return after stopping, do not just restart on your own. Talk to your doctor. You may need further testing. Lifestyle changes matter too. Avoid late-night heavy meals, spicy fried food, and too much tea or coffee. Quit smoking, reduce alcohol, lose extra weight, and eat smaller portions. Sometimes these changes reduce the need for medicines altogether. If you ever have severe pain, trouble swallowing, vomiting blood, or unexplained weight loss, Seek medical help immediately. Do not ignore these red flag signs. So, friends, here is what we learned today. There are 3 main groups of medicines for acidity. Antacids give quick, short relief. H2 blockers last longer and are for more frequent symptoms. Proton pump inhibitors are stronger and used for persistent symptoms, usually for 4 to 8 weeks. Typical doses start low and are adjusted by your doctor. Side effects are usually mild, but long-term use should always be reviewed. And lifestyle changes play a huge role in recovery. Friends, now you know the medicines and typical doses doctors prescribe for acidity and reflux. Remember, never self-medicate for long without medical advice. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Subscribe and share this channel so that more people can learn health in simple and practical language.